I put Karen's. Oh, no, I didn't want to put that, but I put more on that. So at least
Okay. Welcome, everybody. If you know Nathan, you know that he always starts early. So starting on time for this conference is starting early in a sense, and that's very consistent with Nathan. So Nathan Bahr is going to talk to us today. He was raised in California, studied at University of Santa Cruz, UC Santa Cruz, came here in 2005 to do a master's, which means next year he should get a 10-year pin. Took a year off after that and just hadn't got enough of informatics, so he came back to do a doctoral. And he's going to tell us today of what he's learned about situation awareness.
So, colleagues, fellow mentors, and, well, this is a bit loud, and honored guests. Is there a way to turn down the volume on this? Oh well. So, one of the topics I'm interested in is medication reconciliation, because I find that it's a fascinating social phenomenon. This is the general outline of my talk. I'll go through just the nature of the problem that I'm looking at, the definition of situational awareness.
They'll fix it for you.
Okay. The different types and levels of situational awareness, methods involved in actually assessing it in the wild, and applications as they relate to healthcare. So, medication reconciliation is this task where clinicians and pharmacists have to resolve discrepancies across multiple medication lists. This situation arises when a patient may visit different clinicians or different providers, and they each maintain a unique and independent record for them. So from the patient's or from the clinician's perspective, they need to have adequate knowledge about the patient in order to safely treat them and avoid causing adverse events through prescribing medications that might interact. So one of the things that arises from this sort of federated nature of healthcare is that clinicians launch into this exquisite ballet of information retrieval and double checking across records. So, some of the common actions that might occur is that the clinician interviews the patient to check up with their adherence, reviews the medication record, and then digs through a huge pile of notes to see why there might be a discrepancy between them. Now, one way we might look at this problem is through the lens of situational awareness. Situational awareness, generally described, is knowing sort of what's going on in the environment around you. The aviation and military domains have studied this concept in an effort to understand how it affects pilots' performance and to sort of optimize the ability to toss large volumes of information at them without overloading their cognitive visual functionalities. So I think clinicians face the same dilemma in that they need to be able to process increasingly larger amounts of data, particularly coming from other sources like HIEs and other professionals, in order to know what is going on with the patient. So in the next few slides, I'll give a more in-depth description of what situational awareness, because just describing it at the level of, it's knowing what's going on around us is not sufficient for being able to operationalize and measure the concept. As I've dug through the literature, I've noticed that there are different levels of situational awareness. There's an individual situational awareness, there's a team-based situational awareness, and there's this concept known as distributed situational awareness. At the individual level, situational awareness describes the cognitive processes of recognizing cues in the environment, making sense of them, and using that to prime decision-making. At the team level, this refers to how two or more individuals reach a common ground when they are striving towards a common task. When we get to a distributed level, the concept sort of becomes more generalized, and we start including objects in our model in terms of containers or catalysts of situational awareness knowledge or information. So one of the tricky things about situational awareness as a concept itself is that it is a psychological construct that cannot be directly measured. So when we talk about it, we kind of talk about it indirectly or within context to the tasks that are being performed. One of the consequences of this abstract nature of this concept is that a lot of different researchers have developed distinct definitions for the term. One author, Dominguez, from the 1990s, actually identified about a dozen distinct and unique definitions. One thing that I've noticed over the years is that the evolution of this term, it was originally recognized by a German military pilot in World War II known by the name of Oswald Volk, and he described it as gaining superior awareness of your surroundings before the enemy does. As we progress through time, the early definitions described it in context of like a flying task, being aware of objects in the environment, the enemy aircraft, yourself, how your plane is flying, and so on. Then we progress to a more generalized concept in which it is a cognitive process by which we recognize things in the environment and then we make sense of them. So one of the early, I'm not going to go over all of the different models because there are several of them, but I will sort of go over a few of them that highlight the points of contention with actually defining and measuring this concept. One of the earlier representations of this, or one of the earlier researchers of this concept was known by Taylor. He developed something called the situational awareness rating technique. He started off with the definition, with the U.S. Air Force's definition of the concept, in which situational awareness was knowledge about stuff around you. And what he did then was he took several scenarios, he presented them to pilots and had them identify scenarios which were relevant to that concept. And from this, he identified 14 categories related to situational awareness. Situational awareness itself, demands on attentional resources, supply of attentional resources, and understanding of the situation. Within each of these three categories, we have several subcategories in terms of instability, complexity, arousal, concentration, and so on. These are factors that may affect how a person is able to achieve a greater sense of their surroundings. Now, the next sort of big model was proposed by Ensley. Ensley actually embedded the concept of situational awareness within a human cognitive information processing model. So, as humans, we have basic resources in terms of a certain supply of attention, memory. We have the capability to make decisions and make sense of the world, and so on. So what she proposed was that when we actually perceive the world, we do so in three stages, which is we have perception, we have some comprehension of the situation, and then we're able to predict the behavior of the objects we've observed or project them into the future. The interesting thing about this model is Ensley states that this is the state of being for the mind. So one of the distinctions she makes is that situational awareness is a state or a product of the mind of where we know something about the environment, and there's a process called situational assessment in which we reach the state of situational awareness. We might seek out information or receive it through our visual perceptive systems. The interesting thing is that I think it kind of conflicts with the model in that in order to perceive something, that could also be described as a process. One of the main points of contention has been what is situational awareness and what are its components? And one of the biggest points of contention was, is situational awareness a process or a product? Smith and Hancock argued that there is no distinction between the two, because in order to achieve situational awareness, you need to have some prior awareness about the environment. So it's kind of this chicken and the egg issue where you must already have knowledge about the environment, and this primes your ability to sort of seek out more information about the environment, which again primes your knowledge about the environment. So now, I think one of the interesting things here is that they tried to represent a more represent situational awareness as this very deeply complex and cyclical model, but it never quite reached the popularity of Ensley's model because it's very hard to deconstruct and represent in terms of practical research. So from here, I'll dive right into team awareness. In team awareness, it's this notion that you have multiple people working together and that their participation in a group produces emergent properties of situational awareness that could not otherwise be attributed to an individual. Salas originally defined situational awareness as a combination of the individual's awareness and the teamworks or team processes they participate in. Ensley extended her model to suggest that awareness is simply an overlap of knowledge about a particular task between two or more individuals. And Salmon sort of integrated this information into a richer and more complex model. This is sort of Salas's representation of team situational awareness. In it, we have an individual who's participating in part of a team. They have their own prior knowledge and their own processing faculties and their own set of goals. These goals may be shared with other team members as they participate in team-related tasks or processes such as communication and coordination. One thing to note, I'm not really very happy, or I think that this model has certain issues in terms that everything is sort of deeply interconnected, so it's very hard to sort of deconstruct how deconstruct what is how situational awareness is shared. Plus, he also sort of mixes up the terms of situational awareness and goal. Personally, I find that goal is the desired state you want the environment to be in, and situational awareness is the existing state. So, for practical purposes, I find that this model doesn't have a level of refined nature, or it's not refined enough to use. This is Ensley's model. It's a fairly simple model in which you have team members and they have their own distinct awareness that enables them to perform their tasks. Now, they may share or overlap. They may have shared or overlapping pieces of knowledge that they need to be aware of in order to perform sort of joint tasks. The circles represent those pieces of knowledge, or the little gray circles, and the black boxes represent their own distinct awareness, which is separate from their other team members. Ensley sort of characterized team situational awareness as the entirety of this complex. One thing to note, and a couple of other authors have pointed this out, is that situational awareness is not simply the summation of all of the team members' awareness. It's this emergent property of having them understand each other and work together. This is Salmon's integration of the situational awareness across the different researchers. In this, he identifies team processes as leading to a more global level of awareness amongst all the team members. So an individual will have their own sort of set of awareness about, the team, their own goals, and their own activities, and that as they participate in team processes, this will form a greater understanding of what activities the team is performing, what goals the team has, how this and this knowledge of team situational awareness will also feed into modifying their own model of what activities they're performing. Distributed situational awareness, as I've mentioned, includes the notion that artifacts can be containers or catalysts of information or situational awareness knowledge. A lot of this information is an extension off of Hutchins' work, in which he noticed that a system, in order for a system to perform its task, it needs all the capabilities of its different agents. So, for example, I think the off-sided example is that in order for a cockpit to figure out its speed, it needs the combination of the speed booklet and the speed booklet to specify what the ideal speeds are for that particular aircraft and for the particular weight, and then the pilot will mark off speed bugs and say this is how fast you should be flying, and these are what the wing configurations are, and so on. So in this notion, situational awareness can be sort of distributed in that human agents have their own awareness of the environment. They can embed information within other objects that other agents can read and sort of learn what was going on in an indirect fashion. One of the examples provided by, I believe, Artman and Garbus was this notion of a fireman reading a smoke detector on a building. He knows there's a fire by the indirect information that the smoke detector is providing them. So now, Artman and Garbus originally proposed this notion of distributed situational awareness by looking at a Swedish emergency call center. And one of those pictures is actually not from a Swedish center, but from the New York Center. But I thought it was a nice visual. So, anyways, at the center, he looked at two case studies. One in which there are two operators. One operator was listening to a callee who had recently stabbed herself and was calling for a medical assistant. This operator was repeating the story out loud so that their neighbor could listen in and indirectly get a sense of what the situation is. She wasn't directly experiencing or getting the story from the callee, but she was receiving just enough information to know that she needed to call the ambulance and the fire department to get help to that person. The other case that they looked at was in the training sessions for the Swedish call center. They would have the trainees participate in a bunch of tasks and then write down their decisions within a journal or a logbook. And when they reviewed this log, the chief of staff would actually go through and read the information and recount the events as they happened across all of the different individuals. So in this case, the journal stored situational awareness information that the chief of staff could not otherwise contain entirely in their memory or be aware of as other agents were carrying out their tasks. In another case by Stanton, what he did is he tried to develop a measure or a way of sort of operationalizing this concept of of distributed situational awareness. He wanted to move away from this concept of sharing because he felt that sharing put too much emphasis on having all of the team members reach sort of the same kinds of understanding or having a homogeneous understanding among each other. Rather, he noted that instead, each of the different agents had a complementary piece of information that the other required in order to perform their tasks. One of the things he looked at was he looked at workstations on or simulations of a Frigate 22, in which you would have several different military officers be responsible for targeting assessment, for firing upon the enemy, or for commanding the battleship. In this particular image, all of the operators are sitting side by side. They have headphones on. They are primarily communicating through their microphones, and they have sort of a distinct view of the battlefield. Now, sometimes these agents will sort of contact each other or just look at they're in close proximity enough to sort of figure out what view the other person has. And in situations where they're seated too far away, they can simply contact each other through the phone, or through the microphone. So in this situation, the agents have a different view. They have a completely different sense of reality, but they're able to perform their tasks by knowing who has what information and by having a protocol to pass that information on to the next person in a standardized format. Now, I will go into the different methods for assessing situational awareness. Many of these methods are targeted towards assessing individual situational awareness, mostly because that's been more well developed. So the first method was situational requirements analysis. This isn't necessarily a method, but it's a prerequisite for characterizing what situational awareness is. In most of this research, since situational awareness is context dependent, and it falls to the researchers to develop sort of a normative definition of what the task is in order to define what information they expect the subject to actually be aware of when they're studying a certain task. Once they have a bunch of goals and pieces of information that they can sort of deterministically ask the subject if they're aware of or not, they have this. They use a technique called freeze probes. So in freeze probes, what you do is you stick the subject in a high fidelity simulation. You have them perform some task, and at random points in the simulation, you freeze the simulation and you ask them sort of just basic questions, or what are you aware of? In the pilot's case, it's sort of like how many enemy aircraft are there? What is the designation of this aircraft? And so on. This was a method originally used it's used by a couple different researchers, but I think Ensley made it most famous in her Sagat measure. The other kind of, the limitation of the freeze probe was that you have to interrupt the person's task, and this may affect performance. But the nice thing is that you have sort of this objective measurement of what's in the subject's head, and you have a natural way of relating this to performance. Okay, this person has more situational awareness. Do they have better performance or not? Another approach has been to issue real-time probes. In this situation, you don't actually stop it, but you just ask the person as they're doing the task, how many patients are you seeing right now? Do you know this patient's medication? And so on. The tricky part with this approach is that it sort of falls on the observer to develop appropriate queries dynamically and as the task is being performed. Another popular technique that was developed by Taylor was self-rating. Basically, you have these categories of situational awareness, and a subject will perform their task, and you retrospectively ask them, okay, did you feel like you had sufficient awareness? Like, what do you believe was the complexity of this task, and so on. One of the drawbacks of this approach is that it doesn't measure situational awareness per se, but it measures perception of awareness. And this has a nasty drawback also of being correlated with performance, namely, if I perform really well, then yeah, I had great situational awareness. If I performed really poorly, then I didn't have good situational awareness. I didn't know what's going on. Let me see. The other method was the observer rating technique. This is the one in which you have an observer looking at the, basically observing a subject. They have maybe a checklist of behaviors, and they try to assess the awareness from that perspective using their own intuition. This method requires subject matter experts to actually be able to assess the subject's awareness, and in this case, it's questionable whether they can accurately measure what's going on in the head, because there's this unclear relationship between situational awareness and ultimate performance. Finally, we have performance measures. That's in which you infer how well the subject is performing, as whether they have good situational awareness or not. Like, if you have a driver and they're avoiding a lot of different objects, then they're probably aware that those objects are there. Process indices are basically things like verbal protocol analysis and eye tracking. Basically, does it look like these people are following the information, or looking at the right information at the right time? I think the drawback of this is that it doesn't necessarily assess the content or quality of awareness, but it sort of infers it. Finally, we have team situational awareness measures. These refer to sort of a mixture of measures in terms of looking at overlap in mental models and so on. One of the things about these measures is that when we're trying to assess situational awareness, there are certain criteria by which there are certain ideal criteria by which we'd like to measure the construct. Ensley stated that what we'd want is measures of situational awareness do not measure other processes or factors. They possess the required level of sensitivity, and the technique can accurately detect changes in situational awareness caused by novel technologies and programs, and that the measure does not alter situational awareness during the measurement procedure. So things like freeze probes could potentially, or stopping the person in the middle of their task could potentially disrupt them or disrupt their awareness. Also, there's this notion that when we start including when we start measuring properties of a team's awareness, we need more flexibility, because it ends up being more complex or difficult to actually freeze the team and get more information from them. So this is just an example of when assessing situational awareness, there are probably 2 or 3 popular techniques for doing so. One of them is the self-rating technique, mostly because it's fairly simple to implement and it's not intrusive on the subjects. So in this, we can take Taylor's generic set of constructs, like what was your demand on attentional resources, what were your resources, and what was your understanding of the situation. We can also ask them to rate their perceptions on the subcategories, and this is analyzed by summing together the measures and then seeing if there's a difference between a case and control situation. Now, again, there are drawbacks to this method, because it doesn't actually measure situational awareness, but it measures perceptions of awareness. Self-assessment, again, may be influenced by performance, and the measures end up being correlated with confidence levels. And they have generally performed poorer than other types of measures, such as SAGOT. So SAGOT is a technique used by Ensley to stick the subject in a simulation and issue freeze probes to them randomly. So the subject will see this representation on a screen of like what their plane is doing in a flying task, and then they'll blank the screen and they'll ask them a series of questions like, how many planes did you see on the screen? What was their designation? What's the aircraft altitude, and so on. In general, this method has performed very well in actually assessing the contents of the subject's mental models. It has good construct validity, it has good reliability, and so on. I think the only drawbacks to this model, well, this model is, or this measurement technique is very popular because it's well validated and effective, but the drawbacks in using it in a team-based situation is that it's very difficult, again, to freeze the team-based scenario. And I think, and also one of the things is that you may have difficulty in measuring implicit information. So the distinction in situational awareness, there may be a distinction between implicit and explicit information. And this notion that a subject may be able to perform their task without necessarily being conscious or aware that they're performing it. Now, are they technically aware? Do they have a higher level of awareness and they skip the lower levels of perception to get there? And so Sagat and Ensley's model assumes that the subject has to go through the lower levels of cognitive processing to reach that stage. This isn't necessarily one technique for looking at distributed situational awareness models. This isn't necessarily a measurement technique yet. It's more of a descriptive observational model. But Stanton et al. Proposed looking at this notion of a propositional network. Mainly what he did was he used critical decision methods and content analysis to develop this large, complex network of sort of this global information space that might be activated by different users performing different tasks. And this might give us a sense of how awareness might be shared or distributed between the different agents. The results are something along these lines, in which he was looking at agents performing a military exercise of assessing targets and trying to determine fire control. And in this model, he has certain nodes that are activated when an agent is performing their task, and others which aren't activated but may be related to like what they actually need to perform. Now, one thing to note about this model is it's actually very messy and a little hard to discern what is going on. One of the other, I think, methods that might be worthwhile in terms of organizing this information that one of our other fellows have mentioned is this notion of cognitive work analysis. Namely that if we understand how a person performs their tasks and like what tasks they have and strategies they have, cognitive work analysis might be a useful tool for presenting this interrelationship between a person performing their task and using the resources that they have and interacting with other agents within their system. So this is just sort of a set of examples in terms of how situational awareness is applied in the medical field. So, a lot of the different studies I've looked at, they've attempted to look at team-based situations in the ICU or OR where they tried to assess, like, okay, what is the level of communication between these issues? Most of the different examples I've seen, they've issued explicitly surveys or questionnaires retrospectively to see, or to see what their assessment of the situation is, or they've asked or they've taken a look at the processes in terms of how often they participated in team huddles. So, sorry. So, in one situation, in the first example, Wong used a combination of critical decision method and grounded theory to develop a descriptive model of how dispatchers interacted with their control systems to achieve to identify how their mental pictures were maintained and developed. And what they discovered was that, there is a need to sort of maintain a hub strategy and to look at their understanding of structural and temporal relationships between the agents. Parush tried to identify whether communication instances that did not have closed-loop communication events, if they might affect sort of the deterioration or the maintenance of information. So a closed-loop communication is where you send, receive, and confirm that your message has been received. In their study, they found that I believe it was 63% of team situational awareness communication was susceptible to information loss. Reader measured process indices such as frequency, communication, and team huddles to see if they predicted a convergent or divergent team situational awareness. They operationalized this concept as whether the team was able to have the same predictions of what would happen to the patient after 48 hours. So they found that for most cases, the team did not have the same kinds of predictions, and in cases where they were different, the senior doctors had the most accurate representation of what would happen to the patient over time. Finally, Woban had surgeons, nurses, and anesthetists, and nurse anesthetists rate their perceived levels of communication, teamwork, and situational awareness. The distinction they felt was that surgeons felt that they adequately exchanged information, but everyone else didn't. So I'm not sure. And lastly, Yingling performed an interesting study in which she used retrospective probes to see how aware clinicians were of their tasks. Now, these were actually similar to the Ensley-Sagat probes, but she didn't have the freedom to stop the simulation at random points. So she had to issue a bunch of probes afterwards just to assess it. They found that the teams with better communication had better situational awareness, and again, yeah. And I think that was it for the studies that I've found so far. So this is sort of drawing to a conclusion, but in looking at these different methods, a lot of them are sort of targeted to assessing an individual's situational awareness. The limitations of those methods are that they require you to have a subject in a high-fidelity situation and to be able to freeze their task at random points in times. But for more complex team-based situations or scenarios, in many cases, the individual agents may not be co-located in both time and space. So this makes it difficult to sort of take a snapshot of the system. And also most of the time, the the freeze probes depend on having an a priori or normative decisions of what the tasks are beforehand. Whereas if you have a more dynamic and richer task or ability to perform or problem that the agent needs to perform, then it's harder to sort of create a normative definition and to ask them questions about it. So again, this may suggest that in terms of future methods, I would like to apply this to and also looking back at the clinical evidence, most people assess teams that were sort of co-located or part of one system. I think one thing that I would like to do is to see how situational awareness is coordinated when the different agents of a patient's care team are not part of the same hospital system, or they're part of different departments that are physically and temporally located apart. Like, how does this affect the team's awareness of what is going on, and what are the processes that they use to achieve at least a certain level of concordance among the different agents when the patient actually does come in to see them. I see that I may be ending. Well, I think that is about the end of my presentation. I would like to thank my advisors and potential committee members, Dr. Gorman and Nancy Vukovic and Dr. Besselroth. I would like to thank the NLM for giving me this opportunity, the faculty at DMICE, Andrea, Diane, and Lynn, for sort of helping me navigate the more administrative tasks, James and Dion for sitting through most of my questions, and other colleagues and mentors, particularly the folks at the VA for letting me look at some of their pharmacist data. Thank you.
Okay, we invite everyone's questions for Nathan. Go ahead.
Nathan, thank you. However, the question comes up, why is medication reconciliation a hard problem?
Because you have agents working, I think it's because of the affordances of the workplace. Basically, you have agents working apart from one another. They have different goals and tasks in mind that they're trying to perform in making the patient well. They don't have necessarily the clearest channels of communication. They may be communicating indirectly through the patient as they come in with their discharge summary from last time, and this may not give the clinician who's seeing them currently the requisite information to decide whether this information is correct and up to date. So they have to do a little bit more detective work to just assess the validity of the information that they have at hand. Yes, James.
I have two questions. You can pick which one. The first one is we use aviation a lot to compare to healthcare. And I'm curious, in your reading, do you think, does that comparison hold up? Is it instructive for things like primary care, not just what goes on in a small care team like an operating room?
I think for me, I find it a little bit harder to directly apply the models of aviation, because I think that part of the work domain that is the most dynamic and unpredictable is the patient, and that changes on a case-by-case basis. Whereas in aviation and flying, you have a plane. You know you're flying the plane. You know you're flying it through the sky. So a certain amount of the task is actually fixed and can actually be tested with respect to that. Whereas if we want to apply situational awareness concepts to the healthcare field, it would be useful to incorporate the dynamic nature of the patient into that model. Yes.
So, following up on James's question, in the cockpit they're co-located.
Yes.
In medicine they're not.
Well,
How does that necessarily, in primary care they're not?
So,
How does that affect what we're doing?
So, there are a couple of ways to look at this. Technically, yes, the pilot and co-pilot are co-located, but they're not co-located with the air traffic control, but they still have to coordinate their activity with them. And air traffic control has to, in turn, coordinate both that flight's activity and the activity of all of the other flights. But I think for the most part, when people are studying these distributed models, they're simply looking at a cockpit or an ICU or a team-based situation. I think it's a matter of choosing the appropriate unit of analysis. And I think one of the things that we tend to have a habit in terms of analyzing is like a team, a clinical team that's co-located. It's part of the same system. They have the same objectives and norms. But I think one of the interesting things that probably isn't studied well enough is this notion of what is the care team from the patient's perspective, because that may be sort of more dynamic, but there may be some level of coordination that we haven't explored or that we don't quite understand yet. So, anyone else? Yes.
Oh, just a bit of a follow-on. How would using situational awareness actually improve medication reconciliation?
So there's this one concept that I like. It comes more so from the engineering field. It's if you can't measure it, you can't control it. So I think one of the first steps in sort of improving the design of systems for healthcare is being able to measure the system's effect on the clinician's situational awareness. And then once we can actually have a measurable construct, then we can try out different design protocols and see if they improve or disimprove it.
Thank you.
Easy one. And this is a legitimate question. Situation awareness or situational awareness?
That's actually a hard question. I've seen them used interchangeably. I suspect it's more of a stylistic choice that's used between, like, depending on how you form the sentence. So, yeah. Okay, well, I guess thank you.